Hi everybody, Chris Munn here. Today is December 2nd, 2020. It's late in the evening, and I thought I would give a COVID update. I haven't done one of these in about a week, I think, and I thought it was a good time to check in. Today was some really bad news. Today we had 158 new cases recorded. Now that would be for yesterday, which was Tuesday, and 158 is about double what we've been seeing. It's just a really big spike. Now, I'm hoping this is a data anomaly, that we're not going to be seeing numbers like this every day. It doesn't make sense to me based on the curve, but I guess we won't know for a few days. But there's been some talk that it could be from Thanksgiving. But I'm skeptical about that because if it takes 3, 4, or 5 days to get a report back, a result, and you are tested because you have symptoms, that math doesn't work, right? Because if you caught it on Thanksgiving, right, and then you got symptoms 2 or 3 days later, which is usually the soonest you would get it, and then you went for a test, that would be maybe Sunday. And then now on Tuesday, the results are in. That seems pretty quick. So I don't think this is a Thanksgiving related spike. Now it could be something leading up to Thanksgiving or something like that. But my guess is going to be that it's actually a holiday issue with reporting, that maybe a bunch of tests went through all at the same time because of people on, with the Thanksgiving vacation weekend. And they'd be all being reported at the same time. So that's what I'm going to hope. That these 158 cases are from the day before and the day after, and that's when they would normally have been brought in. So let's take a look at where we're at here. So 158 cases. But even if that is true, the 158 being due to the holiday, we've got a big increase in hospitalizations, a big spike. 11 more going from 53 to 64 hospitalizations. And that's from Monday, because again, the Dutchess County dashboard is delayed a day so they can collect all the hospital data, I'm assuming. Now it does say the number of cases being monitored by the county was 664, but we can't really hang our hat on that, the fact that it went down by 8, because again, we just had the holiday, and when we look down low, we'll see that there's hundreds of cases that have not been assigned an address. And of course, we have this 158 cases here that are not yet on the books in the county. So we're going to see this number of 664 spike up just like with the 158. Now again, hopefully the 158 is just a data anomaly. So there were no new deaths reported, which is good. 21 in the last 3 weeks, not great. Of course. The charts are continuing to rise. We're seeing now positive tests sort of evening out around 70 a day. And if it stayed there, that'd be great. But I suspect this is just some consolidation, and we'll probably see an increase. I'm hoping we don't. But again, of course, most troublingly is hospitalizations, because as hospitalizations rise, which they're still rising, deaths follow. And that is not a good thing. Of course, we've got the active cases broken down by municipality, so every village and town listed here. And again, you see all these net changes. They look like negative. It looks like we're doing great. But again, at the bottom, you see that 205 cases have not yet had their address confirmed. So when these all go into the system with addresses, all these numbers are going to bump back up in a lot of these towns. Plus, again, we have the 158. So really there's 205 plus 158, so 363 cases that will go back into this chart soon. And of course we have the COVID report card summaries, 5 new positive in Arlington, 2 positive in Beacon. So this is getting to be pretty common, positive tests in some of these schools. Some of these tests, again, these are tests of children who are between the ages of 5 and 17 that live within the school district. So it's not necessarily an in-person child. So there are links here you can click in to get more details. In Arlington, for example, it says right now only 8% of the students are learning in person, according to the state report card, which is linked there. So presumably some of those 5 positive tests will not be students who are in person. So again, we have all the different schools listed here, and you can go to the hvobserver.com website to see that. So one of the other things I wanted to talk about is these yellow, orange, and red zones. And what that is it's a marker of the intensity of the positivity rate. So I'm not a big fan of positivity rate, but that's what the state is using in order to determine these yellow, orange, and red zones. And positivity rate is just the number of positives divided by the number of tests. And why am I not a fan of this? I think I've mentioned this before. If you just do twice as many tests and you get the same number of positives, suddenly your positivity rate is down by half. Does that really mean that you're safer, or does it just mean you did more tests, right? So that's why we report on new cases, new positives here. But because of the yellow, orange, and red, we're going to start tracking retroactively the positivity rate, since the state is going to use that for these yellow, orange, and red zones. So what is a yellow, orange, or red zone? For our county, when we are a tier 2 county, according to the state, and it's when a geographic area has a 7-day rolling average above 3% for 10 days. So that means for 10 days in a row, the 7-day average of the positivity rate is above 3%, which is a lot of math, but we're basically there, okay? And a geographic area has 12 or more new daily cases per 100,000 residents on a 7-day average. There are 300,000 residents in Dutchess County, and that would be 36 cases, and we are well above that. Now, is all of Dutchess County going to be a yellow, orange, or red zone? Well, we don't know. In all likelihood, it'll be by zip code. If there's part of the county that they might mark yellow or orange or red, the rest of the county would not be affected. So there's the idea that it'll be a zip code or a town or some smaller segment than the county, but we really just don't know yet. For an orange zone, that's a 7-day rolling average above 4% for 10 days. And then for red zone, it's 5%. That is not a really high margin there to have to get to that point. So I want to talk about the schools and how these zones will affect the schools. So the first zone we're going to go to is a yellow zone. So if we're marked in a yellow zone, which is really the only one I'm going to talk about today, because I don't think we're going to see an orange or a red zone for a little while. Yellow zone is coming. I watched County Executive Molinaro's virtual town hall today, and he says he believes yellow zones will be coming to Dutchess within the next 7 days or so. So in a yellow zone, what happens is the schools have to test 20% of their in-person students and staff within 2 weeks after they go to the yellow zone. Now, there was a little confusion about this because it's changed. It changed in mid-November, effective November 16th, and you can see here on this state guidance, effective November 16, 2020, it says they must test 20% of in-person students, faculty, and staff over the 2-week period immediately following the announcement of a yellow zone designation. So that means if Red Hook is in a yellow zone, then the school district must test 20% of the in-person students within that 2 weeks in order to stay in person. Or they can just shut down. Any school district can shut down at any time if they so choose. And when I say shut down, I mean go remote. So basically, if they get it, they test 20%, and the positivity rate, again, that's the number of positives divided by the number of tests given, is lower than the yellow zone around it, then the school can stay open and doesn't have to keep testing. all right, can stay within person. But if it's above, then they have to keep testing every 2 weeks, 20%. So there's not even it's not that there's a specific shutdown number here. What they're talking about is that if you can prove or essentially show that the school the school itself is safer than the surrounding community, then you can stay doing in person. If not, you can still do in person, but you have to keep testing. So I assume at some point, if that number drops lower than the yellow zone, maybe they'll allow to stop testing, but who knows? Now, most of these districts don't have a ton of students, don't have all their students in person, right? So if we look back here, we can look at Red Hook. I'll use Red Hook since that's where I live. It says 68% of students are learning in person. So 20% of those 68% would have to get the test. Now, if this happens in every district, that's a lot of tests. And there's been some concern that there's not going to be enough tests. And I'm very concerned about that. There was an article actually last week in the Poughkeepsie Journal where they basically spelled it out. COVID testing in yellow zone would be too much for Dutchess schools to remain open. And there, it talks about, they actually have the wrong testing in here. They're saying 20% on a weekly basis. But one of the things that you can see in here is that it says that it has an interview, or they're interviewing Dr. Wadian, who is the head of the Department of Health, Department of Behavioral and Community Health for Dutchess County. And he talks about the thousands and thousands of tests, and that the health department says, he says we barely have the capacity to do the positives. And I mean, I have no doubt that the county staff is working hard and trying to keep up, but it's only going to get worse, right? This is a week ago, and now we've got 158 today, and I don't know where we're headed. So this is a big concern. Now, if one school goes into the yellow zone and then it clears and it doesn't have to keep testing, great. And it doesn't go to orange, great. Because orange requires more testing, 20% on a regular basis. And then I think red is 30% on a regular basis. Although that, of course, the state could change that. Then we may be able to get away with this. But if all of Dutchess becomes a yellow zone, I don't know where these tests are coming from. So, we may be seeing these schools having to shut down because of lack of tests. Because remember, it's not just our county facing this problem, but every county potentially is already having these problems. And some counties have been able to support the schools with enough tests, but others, have not been able to. And I believe New York City is completely shut down, right? So where are we now? Well, we are in the middle of the second wave. It's coming to New York. The second wave is really just the extended first wave in a lot of the rest of the country. And we're lucky. We were lucky that we got it down to the point we did. But there's still a lot of people who are getting sick. And there's a bunch of people who are not following the guidance, right? They're not wearing their masks. They're not social distancing. They're refusing to change their behavior. But this is the time when we need to double down on this. This is not the time to give up. I know we're all tired of this. I know I am. But the vaccines are coming. They're months away, but they're coming. I could almost understand wanting to just give up on this and just being so tired of having to social distance and everything and being overwhelmed by it if there was no light at the end of the tunnel. But we're almost there, and we have to get through this winter. There's a few 100,000 vaccines coming to New York over the next couple of months. They'll go to hopefully to seniors and to frontline emergency personnel, and it'll expand from there. So I urge everybody to please wear your mask, please socially distance, please avoid large groups, and hopefully schools can stay open so working people can not have to choose between feeding their families and educating their children at home. And we can get through this together.